Nurse Aide Test Prep Guide PDF. Question 1. A dying client is breathing irregularly. The nurse aide should: Option A. Call the nurse immediately. Option B. Continue to provide comfort care. Option C. Administer oxygen. Option D. Start CPR. The correct answer is option B. Continue to provide comfort care. Irregular breathing, Shane Stokes, is common in the dying process. Comfort care, including oral care and repositioning, should continue. CPR is not indicated unless the client has a DNR status. Do not resuscitate. Question 2. When assisting a client to walk, the nurse aide should walk. Option A. Behind the client. Option B. Next to and slightly behind the client, holding the gait belt. Option C. In front of the client. Option D. Far to the side of the client. The correct answer is option B. Next to and slightly behind the client, holding the gait belt. Walk next to and slightly behind the client on the weaker side, holding the gait belt to provide stability and catch them if they lose balance. Walking behind doesn't allow seeing the client's face. Walking in front is unsafe. Question 3. When performing chest compressions on an adult, the nurse aide should compress the chest to a depth of: Option A. 1 inch. Option B. At least 2 inches but no more than 2.4 inches. Option C. 3 inches. Option D. 4 inches. The correct answer is option B. At least 2 inches but no more than 2.4 inches. Adult chest compressions should be at least 2 inches deep but no more than 2.4 inches. 1 inch is too shallow. 3 to 4 inches may cause injury. Question 4. A client with a pulse of 112 beats per minute is experiencing: Option A. Normal heart rate. Option B. Bradycardia. Option C. Tachycardia. Option D. Arrhythmia. The correct answer is option C. Tachycardia. A heart rate above 100 beats per minute in an adult is tachycardia. This is above the normal range of 60 to 100. Bradycardia is a rate below 60. Arrhythmia refers to irregular rhythm, not rate. Tachycardia may indicate fever, pain, dehydration, or other conditions requiring reporting. Question 5. A client expresses fear about an upcoming procedure. The nurse aide should: Option A. Tell the client not to worry. Option B. Acknowledge the fear and offer support. Option C. Change the subject. Option D. Tell the client the procedure is minor. The correct answer is option B. Acknowledge the fear and offer support. Acknowledging and validating the client's fear provides emotional support. Dismissing or minimizing the fear, A, D, is not therapeutic. Changing the subject, C, avoids the client's concern. Question 6. When communicating with a client with dementia, the nurse aide should: Option A. Use complex medical terms. Option B. Use simple, one-step directions. Option C. Speak loudly. Option D. Ask open-ended questions. The correct answer is option B. Use simple, one-step directions. Simple, one-step directions, example, please sit down, are most effective. Complex terms, open-ended questions, and loud tones are overwhelming and may cause agitation. Question 7. Which approach is best for a client with dementia who becomes agitated during personal care? Option A. Use a firm tone to assert authority. Option B. Provide simple explanations and allow choices when possible. Option C. Complete care quickly regardless of the client's response. Option D. Skip the care altogether. The correct answer is option B. Provide simple explanations and allow choices when possible. Simple explanations and offering choices, example, would you like to wash your face first or your hands, reduce agitation and maintain dignity. A firm tone can escalate agitation. Skipping care is not appropriate. Question 8. Normal oral temperature range is: Option A. 96.0 to 97.5 degrees Fahrenheit. Option B. 97.6 to 99.6 degrees Fahrenheit. Option C. 98.6 to 100.6 degrees Fahrenheit. Option D. 99.6 to 101.6 degrees Fahrenheit. The correct answer is option B, 97.6 to 99.6 degrees Fahrenheit. Normal oral temperature ranges from 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit, average 98.6 degrees Fahrenheit. 96.0 to 97.5 degrees Fahrenheit is below normal, hypothermia. 98.6 to 100.6 degrees Fahrenheit includes normal and low-grade fever. 99.6 to 101.6 degrees Fahrenheit indicates fever requiring reporting. Question 9. The nurse aide enters a client's room and finds the client on the floor. The aide should: option A, pick up the client immediately. Option B, assess the client, call for help, and do not move the client. Option C, leave the room to get the nurse. Option D, document the fall and call the family. The correct answer is option B, assess the client, call for help, and do not move the client. The nurse aide should assess the client, call for help, and keep the client still to avoid worsening injury, possible fractures or spinal injury. Moving without assessment could cause harm. Question 10. When applying gloves, the nurse aide should: option A, wear gloves that fit loosely. Option B, pull gloves over the cuffs of the gown. Option C, wear gloves only for blood exposure. Option D, reuse gloves to save supplies. The correct answer is option B, pull gloves over the cuffs of the gown. Pulling gloves over gown cuffs creates a barrier preventing wrist and arm contamination. Loose-fitting gloves increase the risk of tears. Reusing gloves is never acceptable. Question 11. The nurse aide notes a reddened area on a client's sacrum that does not blanch, turn white, when pressed. The aide should: option A, document it and turn the client. Option B, massage the area to increase circulation. Option C, apply heat to the area. Option D, leave it alone. The correct answer is option A, document it and turn the client. A non-blanchable reddened area is a stage 1 pressure ulcer requiring immediate documentation and repositioning. Massage is contraindicated. Heat is not indicated. Question 12. What should the nurse aide do if a client's oxygen saturation drops to 90%? Option A, increase the oxygen flow. Option B, report it to the nurse immediately. Option C, reposition the pulse oximeter probe. Option D, document the reading. The correct answer is option B, report it to the nurse immediately. An SpO2 of 90% is below normal, 95 to 100%, and requires immediate reporting. CNAs cannot adjust oxygen. While repositioning the probe might be attempted, reporting to the nurse is the priority. Question 13. Standard precautions apply to which bodily fluids? Option A, blood and blood products only. Option B, all body fluids, secretions, and excretions. Option C, only visible blood. Option D, only if the client is diagnosed with an infection. The correct answer is option B, all body fluids, secretions, and excretions. Standard precautions apply to all body fluids, secretions, and excretions, except sweat, regardless of visible blood, treating all clients as potentially infectious. Question 14. What should the nurse aide do first for a client who has fallen? Option A, move the client to their bed. Option B, assess for injury and call for help. Option C, document the fall. Option D, call the client's family. The correct answer is option B, assess for injury and call for help. Assess for injury while calling for help. Moving without assessing could worsen injuries. Documentation and family notification are secondary. Question 15. To prevent skin breakdown, the nurse aide should: option A, keep the skin clean and dry. Option B, keep the skin moist with lotion. Option C, rub bony prominences vigorously. Option D, use only powder on the skin. The correct answer is option A, keep the skin clean and dry. Clean, dry skin is the first line of defense against pressure ulcers. Moisture from sweat, urine, or feces softens skin and increases friction. While lotion is important, too much moisture is harmful. Rubbing vigorously damages tissues. Question 16. A dying client requests to see their pastor. The nurse aide should: Option A, tell the client the pastor is busy. Option B, contact the facility chaplain. Option C, change the subject. Option D, tell the client to pray alone. The correct answer is option B, contact the facility chaplain. Spiritual support is important at the end of life. The nurse aide should contact the chaplain or the client's clergy. Dismissing the request is inappropriate. Changing the subject avoids the client's needs. Question 17. Which sign indicates a client may need toileting assistance? Option A, restlessness and picking at the sheets. Option B, closed eyes and slow breathing. Option C, smiling and laughing. Option D, sitting quietly in bed. The correct answer is option A, restlessness and picking at the sheets. Restlessness or agitation often indicates a need to use the bathroom, especially in clients who cannot verbally express this need. Offer toileting regularly. Question 18. The nurse aide should document care. Option A, at the end of the shift. Option B, as soon as it is completed. Option C, before providing care. Option D, only if the client's condition changes. The correct answer is option B, as soon as it is completed. Documentation should occur as soon as possible to ensure accuracy and prevent forgetting details. Delaying to the end of the shift may lead to memory errors. Question 19. When providing care for a client from a different culture, the nurse aide should: Option A, follow standard procedures regardless of culture. Option B, ask the client about their preferences and respect them. Option C, assume cultural preferences based on the client's appearance. Option D, ask the nurse to provide care instead. The correct answer is option B, ask the client about their preferences and respect them. Asking the client about their cultural preferences shows respect and enables culturally competent care. Following standard procedures without regard for culture may be insensitive. Making assumptions based on appearance can lead to stereotypes. Question 20. When is alcohol-based hand rub acceptable instead of soap and water? Option A, when hands are visibly soiled. Option B, after using the restroom. Option C, before touching a client with clean hands. Option D, after caring for a client with C. diff. The correct answer is option C, before touching a client with clean hands. Alcohol-based hand rub is preferred when hands are not visibly soiled. Soap and water must be used when hands are visibly dirty, after using the restroom, and when caring for C. difficile. Alcohol does not kill spores. Question 21. A client is pacing and appears anxious. The nurse aide should: Option A, ask the client to sit down. Option B, walk with the client. Option C, give the client a sedative. Option D, leave the client alone. The correct answer is option B, walk with the client. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Asking them to sit down may increase anxiety. Sedatives require an order. Leaving them alone may be unsafe. Question 22. The nurse aide is caring for a client who speaks a different language. The best approach is to: Option A, use hand gestures and hope the client understands. Option B, speak loudly and slowly. Option C, use a trained medical interpreter. Option D, ask another client to translate. The correct answer is option C, use a trained medical interpreter. A trained medical interpreter is essential for accurate communication. Hand gestures are insufficient. Speaking loudly doesn't help. Using another client violates confidentiality and may result in errors. Question 23. A client tells the nurse aide that they want to harm themselves. The aide should: Option A, keep the information confidential. Option B, tell the client that they are being silly. Option C, report it to the nurse immediately. Option D, promise the client that everything will be fine. The correct answer is option C, report it to the nurse immediately. Statements of self-harm are mandatory reporting. The nurse aide has a legal and ethical duty to report this immediately. Confidentiality does not apply when there is a risk of harm. Question 24. When disposing of contaminated linens, the nurse aide should: Option A, shake them out before placing in the hamper. Option B, place them in a leak-proof bag without shaking. Option C, fold them neatly before disposal. Option D, sort them in the client's room. The correct answer is option B. Place them in a leak-proof bag without shaking. Shaking linens creates aerosols that spread pathogens. Contaminated linens must be placed directly into designated bags without shaking, sorting, or folding. Folding or sorting would require unnecessary handling of soiled linen. Question 25. The Heimlich maneuver should be used when a client: Option A, is coughing forcefully. Option B, cannot speak, cough, or breathe. Option C, has a minor cough. Option D, is having difficulty breathing. The correct answer is option B, cannot speak, cough, or breathe. The Heimlich is for severe airway obstruction when the client cannot speak, cough, or breathe. A client who is coughing forcefully can still breathe. Encourage coughing.